Morning students. At the end of today's session, you should be able to diagnose this case history and you should be able to comment what investigation will be added to this case history to confirm the diagnosis. So the case history is 50-year-old known diabetic patient brought to the casualty with difficulty in breathing and drowsiness. And you have taken the vitals and you found out the pulse rate is increased, that is 120 per minute, and the respiratory rate is increased 30 per minute, and blood pressure is 90/60 mmHg. And you had done CBG, which was high, so you had sent in random blood sugar to lab and they had given the report as 650 milligram per deciliter. So now the question is, what is the diagnosis and what other additional investigation you will do to confirm the diagnosis? So at the end of today's class, you should be able to answer for this question. So today's class is on ketone body metabolism. So in this session, you are going to learn how ketone bodies are synthesized in our body, that is ketogenesis, and how it is utilized in our body, that is ketone body breakdown, ketolysis, and what are the disorders related to this ketone body synthesis and breakdown, that is ketone body metabolism. We'll start with the ketogenesis. So this ketogenesis can be asked as a separate 5-mark question. If it is asked as a 5-mark question, you have to first write down where it is produced and which substance is required for its synthesis and what are the steps involved in ketogenesis. Let's start with the site of synthesis. So where it is produced, ketone bodies are produced in liver in mitochondria. So why it is produced? Ketone bodies are produced as an alternate source of energy for all the extrahepatic tissue. So why only for extrahepatic tissue? Why not for liver? Because liver has enzyme only to produce ketone body. It does not have enzyme to break down the ketone body to obtain energy from it. Okay, so liver can able to involve only in ketone body synthesis. It cannot utilize energy from the ketone body. So during starvation, our body needs an alternate source of energy, that is the ketone body. So not only liver, even RBC cannot utilize energy from the ketone body because RBC does not have mitochondria, and for ketone body synthesis as well as for ketone body breakdown, both are going to occur in mitochondria. So mitochondria is absent in RBC, so RBCs will not be involved in ketone body synthesis or breakdown. So ketone body synthesis will occur in liver and ketone body breakdown will occur in rest of the tissue other than liver and RBC. So which is the substrate for ketone body synthesis? Fatty acid and ketogenic amino acid. So ketogenic amino acid will enter TCA cycle to form acetyl-CoA, and fatty acid will get catabolized by beta oxidation to release acetyl-CoA. That is, fatty acid, when it get broken down, you will get acetyl-CoA, and ketogenic amino acid, when it enter TCA cycle, it will get acetyl-CoA, and this acetyl-CoA will be utilized for ketone body synthesis. Okay, so there are 3 ketone bodies, that is acetone, acetoacetate, and beta hydroxybutyrate. So these 3 ketone bodies are water soluble. So once the ketone body is produced in liver, it does not need any transport medium. Even though it is a derived lipid, it does not need any transport medium like protein for like any other lipids. It is free, water soluble, so it can able to freely get dissolved in the blood and it will get transported to different extrahepatic tissue including brain, and there it will get utilized. So brain will utilize ketone body as an alternate fuel source of energy during starvation when glucose concentration is very low. So in case of hypoglycemia, the hyperglycemic hormone production will be increased and the hypoglycemic hormone production will be reduced. That is, insulin production will be reduced and glucagon, that is hyperglycemic hormone production, will be increased. So both this will result in increased lipolysis. The major lipid which is present in the adipose tissue is triacylglycerol. So there is an increased lipolysis, there is increased breakdown of triacylglycerol. So the 3 acyl molecule, that is 3 fatty acid and glycerol will split. So you'll get free glycerol and free fatty acid. This free fatty acid will be taken up by protein and it will be transported to liver. Now it has reached the liver. Within the liver, this free fatty acid will enter the mitochondria and it will undergo beta oxidation. That is, the free fatty acid will get catabolized. When you break free fatty acid, you will get multiple acetyl-CoA. So this acetyl-CoA is a precursor for synthesis of ketone body. So now we are seeing how hypoglycemia will result in increased acetyl-CoA concentration within mitochondria of liver. So now we are seeing that within the liver, within the mitochondria, acetyl-CoA concentration will be increased. Next, we'll see how this acetyl-CoA will be utilized to produce ketone bodies. So two acetyl-CoA will combine to form acetoacetyl-CoA, and the enzyme which is required for this reaction is called as thiolase. Okay, so one of the coenzyme A will be released, and this acetyl group will combine with this acetyl-CoA to form acetoacetyl-CoA. So this is the first step in ketogenesis, and this step will be the last step in beta oxidation. Okay, remember, this is the same step which you are going to see as the last step in beta oxidation, as well as the last step in ketone body catabolism. So now acetoacetyl-CoA is formed. To this we are going to combine one more acetyl-CoA, and these two will combine to form HMG-CoA, that is beta hydroxy beta methyl glutarate CoA, and the enzyme which is required for this reaction is HMG-CoA is produced. So the enzyme name is HMG-CoA synthase. Okay, so one more acetyl-CoA will combine with acetoacetyl-CoA to form HMG-CoA. This step is the rate limiting step of ketogenesis. Okay, so the rate limiting enzyme for ketogenesis is HMG-CoA synthase. It's a very important point. HMG-CoA synthase is the rate limiting enzyme for ketogenesis. So now HMG-CoA is formed. Next, we are going to remove acetyl-CoA from HMG-CoA by an enzyme called as HMG-CoA lyase. So HMG-CoA lyase is going to remove acetyl-CoA from HMG-CoA, and the remaining molecule is called as acetoacetate. This acetoacetate is the first ketone body to be produced in ketogenesis. Following this acetoacetate, it will either undergo spontaneous decarboxylation to produce acetone, and this acetone is the second ketone body to be produced, and this is a volatile one. This can be expelled by lung. Or this acetoacetate will undergo hydrogenation to form beta hydroxybutyrate. This beta hydroxybutyrate is an reversible reaction. That is, this conversion of acetoacetate to beta hydroxybutyrate is a reversible reaction. So to convert beta hydroxybutyrate to acetoacetate, we need to dehydrogenate this molecule. So the name of the enzyme is beta hydroxybutyrate dehydrogenase. So during this reaction, NAD will get converted from NADH2. So this is the third ketone body, that is beta hydroxybutyrate. Okay, so we have three ketone bodies: acetoacetate, acetone, and beta hydroxybutyrate. Since acetoacetate is the one which is formed initially in ketogenesis, this is considered as the primary ketone body, and these two are formed later. So acetone and beta hydroxybutyrate is considered as the secondary ketone body. So there are three ketone bodies: acetoacetate, acetone, and beta hydroxybutyrate. Among these three, acetone is volatile in nature, and acetoacetate is a primary ketone body. Acetone and beta hydroxybutyrate is a secondary ketone body. So to summarize ketogenesis, during starvation, there will be increased lipolysis in adipose tissue. When there is increased lipolysis, there is increased release of free fatty acid. This free fatty acid will be transported to liver. In liver, this free fatty acid will undergo beta oxidation to release acetyl-CoA. Two of this acetyl-CoA will combine to form acetoacetyl-CoA by an enzyme called as thiolase. This is the first step in ketone body synthesis. This first step is reversible step. Okay, remember, this first step is reversible step. Then this acetoacetyl-CoA will combine with one more acetyl-CoA to form HMG-CoA by an enzyme called as HMG-CoA synthase. This is an irreversible step. So second step is irreversible step. Once HMG-CoA is formed, from HMG-CoA we are going to remove an acetyl-CoA, result in formation of acetoacetate by an enzyme called as HMG-CoA lyase. This is an irreversible step. So second step is an irreversible step. Third step is an irreversible step. Okay, once acetoacetate is formed, it will undergo spontaneously decarboxylation to form acetone, which is an irreversible step. Or this acetoacetate will undergo hydrogenation to form beta hydroxybutyrate by an enzyme called as beta hydroxybutyrate dehydrogenase. This is a reversible step. Okay, why it is important? Once you had read the ketogenesis, the reversal of ketogenesis will be the ketolysis. Only thing is, in ketogenesis, whichever step is irreversible, for this you have to use some other enzyme. So let's see about next ketolysis. So in ketolysis, we are going to start from the ending of the ketogenesis, that is beta hydroxybutyrate. Okay. So in the ketogenesis, we are seeing acetoacetate will undergo hydrogenation to form beta hydroxybutyrate, and it's a reversible reaction. So to convert beta hydroxybutyrate to acetoacetate, I have to dehydrogenate. So the name of the enzyme is beta hydroxybutyrate dehydrogenase. So we are removing the hydrogen that will be transferred to NAD, result in formation of NADH2. Next, we are seeing this acetoacetate. In case of ketogenesis, we are seeing from HMG-CoA we are going to form acetoacetate, but it's an irreversible step. So we have to use some other enzyme to convert this acetoacetate to acetoacetyl-CoA. Okay, we don't have HMG-CoA here. Directly we are converting this acetoacetate to acetoacetyl-CoA. Okay, so for this we are going to use an enzyme called thioporase. So thioporase will convert acetoacetate to acetoacetyl-CoA. That CoA is obtained from succinyl-CoA from TCA cycle. Okay, now acetoacetyl-CoA is formed. This acetoacetyl-CoA will get split to form 2-acetyl-CoA. It's the exact same reaction which you have seen in the first step of the ketogenesis by an enzyme called as thiolase. So this is the last step, which is a reversible reaction. Okay. Once acetyl-CoA is formed, this acetyl-CoA will enter the TCA cycle, and from TCA cycle we'll get NADH and FADH, which is going to enter the electron transport chain to produce ATP. So totally 10 ATPs will be produced from one acetyl-CoA. So that's all about ketolysis. So if you learn ketogenesis, the opposite to some extent will be the ketolysis. So what is the significance of ketogenesis and ketolysis? So I told you, during starvation, for all the extrahepatic tissue, the major fuel alternate source of energy is ketone body, especially for brain. So during starvation, that is during hypoglycemia, there will be increased lipolysis. So free fatty acid will be released in excess, but the free fatty acid cannot pass through the blood-brain barrier. So the free fatty acid is going to reach the liver. In the liver, it will undergo catabolism to form acetyl-CoA. Acetyl-CoA in the liver will be used for the synthesis of ketone body. Since ketone bodies are water soluble, they can able to freely travel in the blood and it will reach the brain. It can able to easily pass through the blood-brain barrier, and it is going to enter the brain, and that ketone body will be used by the brain as the alternate fuel during hypoglycemia. So this is the significance of ketogenesis and ketolysis. Next, coming to the regulation of ketone body metabolism. So I told you, during hypoglycemia, there will be reduced production of hypoglycemic hormone, that is insulin, and increased production of hyperglycemic hormone, that is glucagon. This too will result in increased lipolysis. When there is increased lipolysis, there will be increased release of free fatty acid. When there is increased release of free fatty acid, it will be taken to the liver. In liver, it will undergo beta oxidation, result in formation of acetyl-CoA, which is the precursor for production of ketone body. So I told you the rate limiting enzyme for ketogenesis is HMG-CoA synthase, and the rate limiting enzyme for ketolysis is thioporase. But if you see, the regulation of ketone body synthesis and breakdown is mainly regulated at the level of lipolysis and beta oxidation. It's not by regulating the rate limiting enzyme. It is mainly by regulating at the level of lipolysis and beta oxidation. That is, during hypoglycemia, there will be reduced production of hypoglycemic hormone, that is insulin. So normally insulin will inhibit lipolysis and beta oxidation. Since insulin concentration is reduced, the inhibitory effect of insulin over lipolysis and beta oxidation is reduced. So because of that, the lipolysis is increased, beta oxidation is increased, which result in increased production of ketone body. As well as during hypoglycemia, there will be increased production of hyperglycemic hormone. When hyperglycemic hormone production is increased, that will result in stimulation of lipolysis and beta oxidation, which result in increased production of ketone body. So the rate limiting enzyme for ketone body synthesis is HMG-CoA synthase, and the rate limiting enzyme for ketone body catabolism is thiopurase. Even though we have rate limiting enzyme for ketone body synthesis and breakdown, it is regulated mainly by regulating the lipolysis and beta oxidation by hyperglycemic hormone, that is glucagon and insulin. So we had seen about ketogenesis, ketolysis and regulation of ketogenesis and ketolysis. Next, coming to the disorder related to ketone body metabolism. The disorder related to ketone body metabolism is called as ketosis. So this can be asked as a separate 5-mark or 10-mark question. It has been frequently asked. So what should be written for this question? So first you have to write down what is meant by ketosis. Next you have to write down what are the causes, clinical feature, investigation and treatment. So we'll start with what is meant by ketosis. In various abnormal conditions, there will be increased production of ketone body. When there is increased production of ketone body, the blood level of ketone body will be increased. That is called as ketonemia. That is, concentration of ketone body in the blood is increased. Ketonemia. When concentration of ketone body in the blood is increased, it will get excreted in the urine. This is called as ketonuria. That is, increased ketone body in the urine. And I told you there are 3 types of ketone body: acetone, acetoacetate and beta hydroxybutyrate. Among these 3, acetone is a volatile acid that can be expelled by lung. So in ketonemia, there will be increased concentration of ketone body in the blood, which include acetone, acetoacetate and beta hydroxybutyrate. So in ketonemia, there will be increased concentration of acetone that will be expelled by the lung. So the patient will be having acetone in the breath. That is, the patient will be having fruity odor or fruity breath. Ketonemia, ketonuria with acetone in the breath, all these 3 together is called as ketosis. Okay, ketonemia, increased blood level of ketone body; ketonuria, increased urinary ketone body; and fruity breath, all together is called as ketosis. Okay, so I told you in various abnormal condition, ketone body production will be increased. So what are those various abnormal conditions? There are a lot of conditions, but you have to remember only 2 of those. That is, in diabetic ketoacidosis, ketone body production will be increased. Second, in starvation ketoacidosis, ketone body production will be increased. Okay, so we expect you to explain how in diabetic ketoacidosis and how in starvation ketoacidosis the ketone body production is increased. So let's see first how in diabetic ketoacidosis the ketone body production is increased. So in diabetic ketoacidosis, that is in uncontrolled diabetes mellitus, there will be severe insulin resistant or insulin deficiency. Okay, so due to this, there will be reduced insulin action. So one of the insulin action is to inhibit the lipolysis. Now the insulin is severely deficient, or there is severe insulin resistant. Because of that, its inhibitory effect over lipolysis is gone. So that will result in increased lipolysis. When there is increased lipolysis, there will be increased release of free fatty acid. This free fatty acid will be transported to liver. In liver, it will undergo beta oxidation to release acetyl-CoA. So acetyl-CoA concentration will be increased. So this is the because of our production of ketone body. So ketone body production will be increased. Okay. Remember, in diabetic ketoacidosis as well as in any diabetic mellitus, there will be severe insulin deficiency. So because of that, the insulin function is reduced, and one of the function of insulin is to transport the glucose from the blood into the cell. So now the glucose is not transported from the blood into the cell. So even though you are having a very high concentration of glucose in the blood, the intracellular glucose concentration is very low. That is, the patient is having intracellular hypoglycemia. So when there is intracellular hypoglycemia, there will be increased gluconeogenesis. Okay, and we had seen in carbohydrate metabolism, in gluconeogenesis, the pyruvate will get converted to form as oxaloacetate, and the oxaloacetate will undergo gluconeogenesis to form glucose. Okay, so now the oxaloacetate is channeled for gluconeogenesis to produce glucose. So oxaloacetate concentration is further reduced. So whatever the oxaloacetate is present, even that is reduced. So normally you need oxaloacetate to combine with the acetyl-CoA to enter the TCA cycle. Now oxaloacetate concentration is very much reduced. So acetyl-CoA cannot combine with oxaloacetate because oxaloacetate is not available. So all the acetyl-CoA will be channeled for ketone body synthesis. Okay. So these are the 2 mechanisms by which ketone body synthesis is increased in diabetic ketoacidosis. In diabetic ketoacidosis, there will be increased blood sugar level. Because of that excess amount of glucose will be excreted in the urine. That is, the patient will be having glucosuria. Okay, and I had told you glucose is an osmotically active particle. So wherever glucose goes, along with that, it will drag the water. Okay, so here the patient is having severe glucosuria, so there will be loss of lot of water in the urine. Okay, so the patient will be having polyuria. So because of that, blood volume, blood level of water will be reduced. So that will result in dehydration. So when there is dehydration, the patient will go for hypotension and tachycardia. Since the patient is in hypotension, the blood supply to the peripheral tissues will be reduced, which will result in cold extremity. And in diabetic ketoacidosis, there will be increased production of acetone, acetoacetate, and beta hydroxybutyrate. Now only we have seen in the previous slide how these three ketone bodies are produced in excess in diabetic ketoacidosis. So acetone is a volatile acid, so that will be expelled by lung. Okay, so the lung will try to expel as much as acetone as much as it can. So how it is going to expel? By increasing the respiratory rate, and it is going to increase the depth of the respiration. This increase in the respiratory rate and the depth is called as Kussmaul's breathing. Okay, so the patient will be having fruity odor in the breath. Okay, so there will be smell of acetone in the breath. Since there is increased amount of ketone bodies, the patient will go for severe acidosis because all the ketone bodies are acids. So the patient will go for acidosis. It is due to the metabolic abnormality, so it is called as metabolic acidosis. In severe metabolic acidosis, the patient's brain will be damaged. That will result in confusion, drowsiness, and coma. So these are the clinical features. Next, coming to the investigation. So to diagnose a patient is having diabetic ketoacidosis, you have to have two important criteria. That is, blood sugar level should be more than 200 with ketone body presence in the urine. So there will be increased ketone body in the blood, ketonemia, and increased ketone body in the urine. That is ketonuria. Apart from this, the patient will also have hyponatremia, that is reduced sodium level, hyperkalemia, increased potassium level, and metabolic acidosis, which can be detected by measuring the arterial blood gas analysis. So these are the investigation you have to do. Coming to the treatment part of diabetic ketoacidosis, we'll be giving insulin initially as loading dose, followed by infusion based on the blood sugar level, and we'll be giving 0.9 normal saline, and we'll be correcting the potassium and metabolic acidosis. In this particular case, that is in diabetic ketoacidosis, the type of metabolic acidosis is called as high anion gap metabolic acidosis. Again, we will teach you in detail about acidosis, normal acid-base balance, and what is meant by high anion gap metabolic acidosis. But for today's class, just remember, in diabetic ketoacidosis, the type of metabolic acidosis is called as high anion gap metabolic acidosis. This is very important. It is called as high anion gap metabolic acidosis. So that's all about diabetic ketoacidosis. In starvation ketoacidosis, there will be hypoglycemia due to starvation. So when there is hypoglycemia, there will be increased production of hyperglycemic hormone and reduced production of hypoglycemic hormone. That is increased production of glucagon and reduced production of insulin. This will result in increased lipolysis. So when there is increased lipolysis, there will be increased release of free fatty acid. This released free fatty acid will be transported to liver. In liver, the free fatty acid will undergo beta oxidation to produce acetyl-CoA. Okay, normally this acetyl-CoA will enter TCA cycle. But here, since it is produced in excess, this excess amount of acetyl-CoA will be channeled for production of ketone body. Since the patient is in hypoglycemia, this hyperglycemic hormone will favor gluconeogenesis. So in gluconeogenesis, all the oxaloacetate will be channeled for production of glucose. So the oxaloacetate concentration is further reduced. So normally oxaloacetate will combine with acetyl-CoA and it will enter the TCA cycle. Now the oxaloacetate concentration is reduced. So even this acetyl-CoA will be channeled for ketone body synthesis. So there will be further increase in the ketone body synthesis. This is how in starvation ketoacidosis, ketone body production is increased and oxaloacetate is reduced. So TCA cycle will not occur. So coming to the clinical feature of hypoglycemia, we can divide it into symptoms of autonomic nervous system and symptoms due to deprivation of glucose to brain. So in case of symptoms of autonomic nervous system, the patient will be having sweating, tremor, palpitation, hunger and anxiety. In case of deprivation of glucose to brain, the patient will be having clinical features of confusion, drowsiness, poor coordination and speech difficulty. So these are the clinical features. So when you have a patient with above clinical feature, you have to do random blood sugar level. If the random blood sugar level is less than 70 milligram per deciliter, then the patient is having hypoglycemia. So in case of hypoglycemia, if you measure the urine ketone body and if it is positive, then you can say the patient is having ketosis due to hypoglycemia. So what is the treatment? In case of patient is conscious, you have to give oral administration of glucose, and if the patient is conscious or unconscious, you have to give 50 ml of 50% dextrose as IV bolus, followed by 10% dextrose IV drip over 24 hours. So 99% of the time the patient will recover. Very rarely we have to give glucagon and dexamethasone. So these are the treatment for hypoglycemia. So in diabetic ketoacidosis and starvation ketoacidosis, Rothera's test, which is done to detect the ketone body in urine, will be positive. And in case of starvation ketoacidosis, the Benedict test will be negative because Benedict will give positive only in the presence of glucose or any reducing substance in the urine. And in case of diabetic ketoacidosis, Benedict will be positive. And blood sugar level will be elevated in case of DKA, diabetic ketoacidosis, and it will be reduced in case of starvation ketoacidosis. So coming to the set index question. So this is a case of diabetic ketoacidosis. So how I am telling it's diabetic ketoacidosis, the patient blood sugar level is more than 200. So to confirm whether it is a diabetic ketoacidosis or not, I have to do urine ketone body. So that's the additional test which we have to do. So due to the Kushmal's breathing, the patient respiratory rate is increased. Due to the dehydration, the patient pulse rate is increased. So it's a case of diabetic ketoacidosis. To confirm it, we will collect the patient urine sample and we will try to measure the ketone body in urine. So that's all about ketogenesis, ketolysis, and disorder related to ketone body metabolism. Thank you.